Welcome back, everybody. My first guest tonight is a professor of medicine at New York University, a physician at NYU Langone Health, and the chief medical correspondent for CBS News. Please welcome back to A Late Show, Dr. Jon LaPook.
Hi, Stephen.
Hello, Dr. LaPook. Nice to see you again.
Nice to see you again in your new digs.
Thank you very much. Are you in the same digs, new digs? It's been a while.
I'm in the same. Actually, I think last time I was in New York City, and I'm up in Vermont now. I'm remotely broadcasting.
Okay. My best to the cows. Doctor, sadly, the United States just passed 5 million coronavirus cases. Where are we as a world fighting coronavirus, and where is the United States within that picture?
Well, I've been saying from the beginning, this is going to have a beginning, a middle, and an end. And right now we're in the thick of it. I mean, we are in the middle of it, and I'd like to think that we were doing better than we actually are. I mean, I've been disappointed that we haven't all been rowing in the same direction. There's been some mixed messaging. But on the positive side, you've seen this tremendous private, public, academic partnership that's done all sorts of really impressive things. So a mixed grade right now.
3 viable vaccines are in testing right now. A lot of people think of a vaccine as a cure-all. Let's say we get lucky and one of these vaccines turns out to be effective and safe at the same time. What does that look like? How does it roll out? And when are we normal again?
Yeah, that's a great question. And it's one that Tony Fauci has been talking about not wanting people to have unrealistic expectations. So let's say everything works out well at the end of this year, beginning of next year, we've got a vaccine that we're ready to give to people.
And that's it. Hold on, just stop you right there. That's as fast as you think. Still, even with all the progress that's been made, that it's end of this year, beginning of next year, when its efficacy and safety is proven?
I think so. You're seeing testing right now. There are these big phase 3 trials, so people are getting it. They're getting the vaccine. And then the question is, how many months need to go by before we realize that it's safe and effective? So far, it's been safe. And so far, at least in the lab, we're seeing immunologic responses in people's bloodstreams that look promising. The big question is it going to really work in real life? And for that, we need many thousands of people out there actually getting the vaccine in areas where coronavirus is rampant. And sadly, coronavirus is widespread enough in the United States and in the world that there are sites where we can adequately test it. The unrealistic expectation thing that Tony Fauci's worried about is, okay, it's January, say, we're rolling it out. And they're already betting, they're manufacturing hundreds of millions of doses of these now. They're not waiting to see whether the tests are successful. And they're saying, okay, if it turns out that it's successful, we'll have all of these doses of vaccine. If it's not successful, we throw it out, and all we've lost is money. But it's still going to take months to roll it out. It's going to take a while to see, is it effective? Do we need a booster? So people shouldn't think January, February, March, it's back to normal. At the beginning, there's going to be a crossover period where we still need to do all the things we're doing right now, which is wearing a mask, the social distancing, and things like improving ventilation indoors.
A new Gallup poll says that 1 in 3 Americans would not get the vaccine today, even if it were FDA approved. What does it mean to getting the country back on track if a third of us won't take the vaccine?
It is a significant problem, Stephen, because think about this. The concept of herd immunity, which is what percentage of the population needs to have immunity to protect people who aren't immune. So that number, it's argued about, but let's say it's 70%. Well, if 30% of the country is not taking the vaccine, then the other 70% of the country who takes the vaccine has to be 100% effective in order for you to get that 70% herd immunity. It's going to be a big problem if 30% right off the top don't take it.
Major concern for a lot of people, and it's in the news all the time right now because of the calendar, is getting children back in schools. The president has said, well, children don't really get it. But are we learning that children can not only get COVID, but spread COVID?
There's no doubt that children can get COVID. Fortunately, they don't get as ill the death rate is not nearly as high as people who are much older. But there's no doubt that they can get it. And the big question is, to what extent can they spread it? If they're at school and they pick it up at school and then they bring it up and infect grandma, that's pretty bad.
Is there any reason why COVID wouldn't spread as much as, say, a common cold? Because I've had children. The children are disease vectors. Like every parent, once their kid starts going to school, the whole family gets sick. Why would this be any different?
Well, the common cold, actually, this is a variety of coronavirus, which is in the family that causes the common cold. But you're absolutely right. I've had kids too, although they're now 24 and 28. But when they were little, they're all over each other. There's no way you're keeping them away from each other. They're doing everything that you can imagine to infect each other. I think in terms of the school, the first thing that parents need to ask themselves is, does it make sense? Does it even make sense to try to go back in the area of the country where I am? So if it's rampant, it's one of these red zones, it doesn't make sense to try to go back because you're just looking for trouble. If it's a green zone, if it's one of those places where there are relatively few cases and the percentage of positive cases in surveillance examinations is relatively low, then you have to ask, is the school district adequately prepared? And the devil's in the details there. So one, is there a plan that says wear masks, do physical distancing? And then this thing about ventilation, which I think as it gets to be the cold weather, we know that outdoors is a lot safer than indoors. And a lot of these schools may have old ventilation systems. Are they adequately addressing the question of indoors with relatively poorer ventilation? Are there adequate measures to make sure that the air is healthy?
Okay, testing. President says we've done 55 million, 60 million tests, more tests than anybody else. Have we done more tests than anybody else in the world?
We actually have done more tests, but the problem is that even though we're doing all these different tests, our death rate per 100,000 population, the last time I looked, it was like number 4 in the world. So it's not just a matter of how many tests are you doing, it's what's going on in your country. Is it a huge outbreak? We want to do more testing, but as you do more and more testing, if you would expect that you'd be testing people who aren't as sick. So you would think that the percentage of people who are testing positive would go down. Well, until recently, it's been going up. I have to say, in the last week or so, it went to about 8% last I looked, and now it's starting to go down in some areas. But the problem is, Stephen, that our 50 states, it's like 50 different countries. So go try to figure out what's going on in what area, depending upon the politics. It's really hard. There are websites that you can find that'll tell you what's going on in your neighborhood. I have to say, in terms of the schools, parents, how are they going to keep track of this? What's going on in their neighborhood and what's going on in terms of recommendations? CBS News has this series called School Matters that's going to start next Monday. And it's to try to help parents. It's going to be on the CBS Evening News with Nora O'Donnell, who I know was a guest on your show recently. And we're going to have it on CBS this morning too. We're going to go over all kinds of things like ventilation, how do you know if it's safe in your school, what's the psychological issues that you have to address, all sorts of things having to do with school.
Now, let's talk about the speed of testing. A lot of testing now is taking 4 days, still a week to get results back. Why is it so important to get the results back for 24 to 48 hours?
Yeah, if you take a test today and you get the result back 7 days from now, what good is that in terms of protecting the community? Because the whole idea is that if I'm infectious, I want to know about it quickly, like within 24 hours or sooner, so I can sequester myself, I can quarantine, and then somebody in the public health department can figure out who my contacts are and isolate them. If it's happening 7 days later, by then I've already infected who knows how many people. So one person who I saw suggested if a lab gets a result back more than 72 hours later after you took it, don't pay them for it. I think there's got to be some kind of incentive to turn it around more quickly.
Doctor, we have to take a quick break, but stick around, everybody, because when we come back, I'll ask Dr. LaPook the biggest misconception people have about testing. Stick around.